Dr. James Carter from the Center for Functional Medicine at Cleveland Clinic to the stage. I don't think I have to give a lot of introduction of Dr. Carter, but I thought I would do something that was a little bit more interesting, and I'm going to read to you a couple of testimonials from patients of Dr. Carter. So bear with me, I'm going to look at my page because it's important that I get these right. I have been to over a dozen doctors and specialists in the last 20 years. I've had numerous medical tests completed, multiple negative results. Doctors have chosen not to move forward with helping me based on these tests. I had decided that this would be the last time that I would step into a medical office. If Dr. Carter could not help me, that would be it. For the first time in 20 years, I feel seen. I feel heard. I feel validated in my symptoms. Dr. Carter's gentle confidence gives me hope that I may have a better quality of life ahead. That's pretty cool. You join me here. I'll read just one more because it's short, and I thought it was sort of sweet. Oh, you got your, yep, there you go. The last one that I loved was, Dr. Carter's a great doctor. That like gets to it, right? It gets right to the point. So we're going to just have a talk about kind of Dr. Carter's vision and some of the things we're seeing in functional medicine and share some ideas with you. I hope that this will be a time for you to think about and reflect on the questions that I'm asking and how you might answer them, and give you something to take back and remember this concept that I mentioned earlier about the power of you. I think we're going to be seeing the power of Dr. Carter in this discussion. So I'm going to get started. I was really surprised when you agreed to do this interview. So first of all, I think you were the first speaker this morning. You're really busy. Like many of you, he's been working on charts between sessions. But why'd you say yes?
I want to talk. And I want to talk about what we can do. I want to dream together. I want to have a conversation about what the possibilities are. And I respect you, and I owe it to IFM for changing my life, so I want to participate as much as possible. So a lot of reasons.
I like those reasons. Okay, so if we start there, and we don't all know your history, but we have talked a little bit about sort of when you made the decision to shift and think about functional medicine, when that really came into your view and what that looked like. And I thought it would be helpful to share that because we do have a lot of people that are new to functional medicine actually in the audience.
You know, every time I'm asked that question, it helps me reflect on a pretty long journey where I started out with a certain perspective about how I'd be impactful in this society and combining some of my loves together. I loved biology, I loved people, so I majored in sociology, and I decided to be an interventional cardiologist and enjoyed that work, very hard work, and kept expanding it because people had presentations that were not quite in the textbooks. I had to keep learning. And along the way, I was challenged by things that were surprising when I was practicing the way I thought I was supposed to practice. And I remember having a patient come in with a heart attack, and I put a stent in. The rest of his coronary arteries looked normal on the angiogram, and 5 days later he came back with another heart attack. A different artery had become occluded with a different blood clot, even though I put him on all the medicines I was supposed to put him on and told him to eat a heart-healthy diet based on my narrow understanding of what heart healthy was back then. And when I was curious about that and confused, a friend of mine sent me an article on leaky gut And I read that article and realized I had a major knowledge gap, and I started to pursue filling that gap with an online nutrition course, and then that led me to find out about the Institute for Functional Medicine. And I came to the first conference in, what was it, 2014, David? Something like that. And I sat there stunned at what I didn't know. And I said that I was going to make a shift gradually, but I still would hold on to my core of who I am as a scientist and someone who wants to help people as best I can.
That's a pretty good reason, right? Thank you for sharing that. So as you were sort of heading that direction, you probably were realizing that there are people out there that have a misconception generally about medicine, and then you likely ran into people that had a misconception about functional medicine. But let's start with just medicine. What do you think the general misconceptions are about medicine?
I think it's not uncommon for people to forget, surprisingly, what we're here for. And it's about the patients who come before us and their circle and their community. And it's easy to come into this space with our own agenda when we forget that. And I used to do it routinely. You know, oh, thanks for coming in. Let's talk about your blood pressure, your LDL, you know, your BMI. And so I think that's a natural tendency because it's easier to do that. But it's a lot harder to be present in the space and be open to whatever direction the encounter takes you. And it requires being pretty knowledgeable about a number of things, but most of all, it requires being humble enough to say, I don't know, and do it in a way that's caring and kind.
I don't know is sometimes a hard thing for any clinician to say, right?
Yes, but I teach medical students and residents and fellows that being able to say, I don't know, saves lives. And you have to be comfortable with that.
Yeah.
So I think that, for me, that's the misconception that, you know, we create algorithms, we design research studies that's based on our point of view and forget the point of view of the patient.
Like that. I think Dr. Brizzorno, I don't know if he's here, but Dr. Brizzorno earlier today said we get very focused on the things we know that we need to be thinking about in medicine, and then all of a sudden we realize we got to go backwards and say, what is it that the patient needs? Where do I need to be thinking about the patient? So that theme seems to be coming up a lot. So that's misconceptions about medicine in general. Functional medicine, I think all of you that are sort of either learning about the phrase or learning about the term or have been a part of it for a long time, sometimes gets a bit of a bad name because it oftentimes is associated with lots of labs, lots of supplements. Why do you think that is, and how do you think we might think about that?
The most common thing I come across is people not knowing what it is. And that still is more common, the most common thing. And they'll say to me, even when I left Colorado and went to Cleveland, most of the comments was, what is functional medicine? What do you mean you're leaving this department to go there? What is that? Then the other subset, I think that, you know, they see articles or they have people talk about their experiences, and they focus on an aspect that I don't think is functional medicine. And so they may talk about leaving a practice with a bag of supplements and a battery of tests that are difficult to interpret, and then when they question about the results of the test, they can't get a good, concise answer about what the tests actually mean. But I think that, and so that causes some confusion and appropriate concern. But I'm not so sure that it means that there's a bad rap, because everywhere I travel, people want this. They want functional medicine. They want this approach because they recognize that it expands the toolbox to help people. How we do it is challenging, but I think most institutions and places want it. Not everybody within those places, but there's a big recognition that there's something missing.
Kind of along those lines, but taking it a little bit further, when you said that some of your colleagues in Colorado said, well, what's this functional medicine thing? And even though the Center for Functional Medicine has been at Cleveland Clinic since 2014, I think, there are still people at Cleveland Clinic that aren't quite sure what functional medicine is either. So when you run into a peer or a colleague or you're part of an event and somebody says to you, so what is functional medicine? How do you respond to that?
That answer has changed over time, but I mostly say that it's an approach to care that focuses on what the body is trying to do to function, and looking at it from a biological point of view, not necessarily an organ system point of view, and relating that to the context of living. So making sure that we don't forget that there's an intersection between the two, and understanding that that intersection started before birth and extends all throughout the time course of life. And that gives us an opportunity to be more understanding and show more empathy about what people are experiencing. And that is the stepping off point for a therapeutic encounter.
Yeah, great. One of my favorite comments that you've made, as we've talked so much about the importance of expanding the evidence base for the functional medicine model, or is there evidence for that particular therapeutic? And you make a statement that I love, which is, the evidence is there, you just haven't looked hard enough. And you usually mention the standards of care as well.
Yeah, the cardiology guidelines, for example, for chronic coronary disease is all functional medicine. I mean, it's filled with functional medicine. It talks about environmental risk, it talks about mental health, it talks about sedentary lifestyle, it talks about nutrition. It's all in the guidelines. And it doesn't exclude pharmaceuticals, right? And people tend to lean into the things that are easier. But what I'm quite proud of is that we have potential solutions that are simple for those other parts of the guidelines. There was a report about the global burden of cardiovascular disease, and in that report, the summary was, we know what to do. We know that what causes heart disease, and we know there are simple measures that people can take to significantly lower risk and lower the incidence of events. So let's do it. To me, that says, hey, that's us.
Yep.
You know, I went to a talk at the American Heart Association in November. One of the leading cardiologists talks about how this needs to start early in life, and we need to factor in a personalized way, all the things that lead to atherosclerosis and cardiovascular disease. So functional medicine talk. So it's everywhere.
Great. One of the topics that we've been talking a lot about here at the conference, and really I don't think you can go anywhere and not talk about AI, artificial intelligence, and how it can be utilized and how it can save time for you and how it can do this and this and this. And so I'm curious your perspective. I think it's interesting to think about it both from your personal experience but also in a larger institution. What are your thoughts?
I don't anticipate that AI is going away anytime soon.
No.
So I think we should be careful about how we use it. One of the things that drew me personally to functional medicine is the focus on connecting to the patient and really understanding their context. And I think that requires an element of humanity that it is difficult to duplicate with a computer or an AI tool. I think we can use those tools to support the work we do, to make it faster to get information that we may have at our, in our brain, but we can't quite get it out, and we know we read it somewhere or saw it somewhere. But it cannot, in my opinion, cannot replace the subtlety of watching how a patient walks into the room, how they sit down, how they turn to their partner, how they answer a question, their body language when they are faced with a difficult question, or their shift in voice when they identify a childhood event that I would interpret as traumatic, that they are interpreting as a memory. And it gives, so there's a human element to it that I'm not sure we can duplicate. And I'm certain that we should not try to. I think it's very easy to just have a patient write down a list of symptoms and then feed it into a computer and give them a plan of care, but I don't think that's medicine.
There you go. I appreciate that. Thank you. We've been, during my opening, I mentioned that it feels like functional medicine is in the news quite a lot, and certainly reversal of chronic disease, ending chronic disease, these concepts that we talk a lot about in the functional medicine community. And there's certainly a lot happening around the Make America Healthy Again Commission. I'm just curious sort of what your thoughts are around that, setting aside not a political discussion, but just what are your thoughts around kind of the current buzz?
I don't know that I spend much time considering buzz. I spend most of my time considering my why and what I try to do every day. And I think most of us do that. Like I said, I want to be impactful, and I want to help people be healthy. So I don't feel a shift. I mean, it's what I do. I mean, I don't know that I would have gone through 14 years of training without that being my North Star. And many people have had similar experiences of getting educated and learning so that they can help. So I know that I just don't spend time doing that. I stay true to what we're trying to do, and that allows us to resist the waves of voices outside of us.
Appreciate that. Thank you. The last speaker today, Dr. McGonigal, is going to be talking with us about joy. So let's shift for a moment, and then we're going to come back for one more question. But let's shift for a moment and just, what is it that brings you joy in your practice?
It's that moment of connection. Sometimes it's immediate. Sometimes it takes 59 minutes. Sometimes it takes a second visit. But it's that moment where there's this release. The guardrails come down on both sides, by the way. It's not just from the patient's side, it's our side. And I get an energy from that keeps me going. It's really, and I'm an interventional I was an interventional cardiologist. I don't do procedures anymore. That was always a means to an end. It wasn't where all the joy was. The joy was afterwards, when I got back to the clinic and I sat down with the patient and I talked about their family and their friends and their kids and their grandkids. That's where the joy was. So the ability to do that, and then, it's an honor for people to, share their personal lives with you. And that's joyful, to be in a position where you can receive that and then know how to, process it and give it back to them in a different form that helps them. Every day is joyful.
Right.
You know, I find the work joyful. I really do.
I'm glad that you do. It's wonderful. Just along those lines, just to drag a thread, and I'm going to put a question to you, but I think it wasn't one we talked about. But when you engage with a patient, what do you think the thing is that they're looking for most?
I'm certain of what they're looking for now. I wasn't certain before. They want someone to listen to them. They want someone to hear them. And they want someone to be authentic. And if we do that, we can help people a lot. Sometimes just from that. I've had visits where I spend the whole visit doing that, just getting, knocking down the barrier somehow just to get the connection. So and I listen to family and friends. The last piece they want is someone who's curious enough to help. Who's not just going to dismiss them without thinking.
Good. We've gone through a lot of questions. Is there anything that you also want to share with the audience about your experience, about kind of what's still driving you, what you see ahead that excites you about functional medicine?
I have to tell you, when I switched jobs, first of all, my interview for that job, one of the people who interviewed me did what you did. They pulled out things patients had said to me online and read it to me during the interview. It was wild. And so now I'm used to it, so that's why I could handle it. I travel all over, and I'll tell you, people want good care, and there's frustration. But they want our opinion based on a scientific approach. That's what they are asking for and begging for. And they, because we are one of the few practices that do it with insurance payers, they get on a plane for this. They will get on a plane just to have someone say, "Can you tell me what this means? I don't understand and I'm concerned." And I think we have an opportunity to reach everybody. The future of what we do will not be exclusive. The future is to use these tools to help people who don't have means, who are under-resourced, and who are challenged by the volatility of living, and also use the same toolbox to help people of means who have enough money to fly wherever they want. And the humanity is that we're actually all the same, right? So we should be able to create a system that does help both. If we don't do that, then we're not thinking hard enough, in my opinion, and we're not actually being innovative. If innovation leaves a group behind, I'm not impressed.
That's a good statement right there. I love that. Love that. I'm going to read one more because I didn't read them all.
Oh, no.
I was very happy with my care from Dr. Carter. I am a nurse. I think this one I saved because I am a nurse, and I have told many people that it was by far the best doctor appointment I have had in my life. Dr. Carter was very prepared for our session. He was a wonderful listener and inquisitive regarding my concerns and my goals, which I love that too. Dr. Carter provided comprehensive, holistic recommendations, and I am grateful. That one I thought was particularly telling about you, but also about functional medicine, because, and I think I'm not speaking out of school here, but I think to have one clinician say about another clinician, I felt heard. this felt good to me is pretty amazing, and not something that I suspect happens all the time. So it's been an honor, actually, to be able to sit here, and an honor anytime that we get to communicate. And I hope you all enjoyed speaking with Dr. Carter today. Thank you so much.
Very grateful. Thank you.
I'm going to give you a hug here. So, oh good, he's right there. I think Dan's going to come up and introduce our last speaker. So Dan, come on up. And our live stream audience is staying with us. I hope everybody's enjoying it. All right. I don't have a clicker.
You're going to take that? You don't have a clicker, okay.